And the first of them is Thomas Lombes, if you can join me. Maybe the other can come on stage and take a seat too. Thierry Hulot for the LEM, Marc Bonneville for Harris, please. And maybe if Rosalie Maurice is already here, she can come and sit down too. All right, you've just, yeah. You can take a seat. And the first to speak will be then Thomas Lombes, your Deputy CEO for Strategy at INSERM. Thank you.
Ladies and gentlemen, dear colleagues and friends, I'm Thomas Lombes, Deputy CEO for Strategy at INSERM, and it's my honor to be with you today to address you at this international event on behalf of the French academic research players in the biomedical field. So thank you for joining us for this important occasion, and I'm delighted to see such an audience, including 50 top academic teams, French top academic teams, and over 75 companies ranging from small innovative startups to big pharma companies. So today's topic, gene and cell therapies, is indeed of strategic importance. These therapies represent a major research area and a booming industrial sector with economic impact and also a lot of scientific, technological, and health-related implications. These therapies offer promising avenues for treating a wide range of diseases, but they also come with several challenges. Just to mention a few, efficacy, because achieving consistent and durable therapeutic effects can be challenging. Delivery, because ensuring that a gene or cell reaches the intended site in adequate amounts and remain functional is crucial for the success of the therapy. Safety, because gene and cell therapies can sometimes trigger side effects. So we need to be able to carefully assess potential risks, but also manufacturing and scalability, because answering reproducibility of the manufacturing process while maintaining product consistency and quality is not an easy task. So you would probably have guessed at this point that I'm not an expert on these subjects, but what I know is that we need to collaborate to tackle these challenges. And in France, there is a strong and growing interest among researchers to work with industry and even sometimes create their own companies. And these collaborations are in everyone's interests. For companies, because public research represents a fantastic source of innovation and therefore growth, but for public partners also, because engaging with real-world applications and accessing different expertise is a strong source of inspiration and a driver, often allowing us to push the boundaries of knowledge. Moreover, if we are truly to help patients, scientific and medical advances and discoveries must eventually reach the market, and for this we need industry, of course. So how do we push this a step further? I'm here to tell you France possesses significant assets to compete on the global stage, and first and foremost, the high quality of its academic research, once again, recently highlighted by the European Patent Office, for example. France holds the second position in Europe for clinical trial and early stage research, and I understand that more than 500 therapies are currently in the pipeline. However, I believe that there is still room for growth. I will finish by a word about our President Macron's vision about our national research landscape. As you may know, INSERM is a major biomedical research organization with an annual budget of around 1.2 billion euros and around 350 labs everywhere in France, connected with our partners, university, hospitals, and other academic partners. And President Macron decided to create within our organization a programming agency, empowering us to define and implement strategic national biomedical research programs And you will have, I think, a nice example of what these future programs could be with the 80 million euros research program on biotherapies and biomanufacturing that will be presented tomorrow morning, I think, and that is coordinated by Interm and SEVA. So in conclusion, I urge you to consider France as a strategic partners in research for the next generation of gene and cell therapies. And I hope the discussions over the next 2 days will reinforce this belief, because collaboration and innovation are key to our success. So I wish you an excellent symposium. Thank you very much.
Thank you very much. Thank you, Thomas Lombes.